Welcome to The Whole Pineapple. I'm Ruby Booras. I'm here with Ann Judge. She's my coworker. We are both nurse practitioners at Seattle Reproductive Medicine, which is a fertility clinic in the Puget Sound region. We have multiple locations. I work in the Tacoma office, and you are in Kirkland. We have clinics in Seattle, Tacoma, Bellevue, Kirkland, Everett, and Spokane, Washington.
So we are, the Northwest's largest reproductive clinic. And I think people sometimes forget that doesn't just mean IVF. Like we do reproductive endocrinology, so we have management of PCOS, people that aren't yet trying to conceive, fertility preservation, surgical management of conditions. So there's a lot more to a reproductive clinic than just IVF cycles.
Yeah, and just the fertility part. So reproductive endocrinology we're talking about reproductive hormones, basically. So we manage reproductive hormones. So it doesn't necessarily, a lot of our patients aren't necessarily trying to conceive, or that's not their end goal right now. Some people are wanting to preserve their fertility and for future use, like freeze their eggs or sperm. And then other people are here because of like polycystic ovary syndrome, and they're trying to manage their hormones. So we really get all types. It's a fun practice because we get a lot of different things.
In terms of who the podcast is for, I mean, I think this podcast is for anyone that is interested in wellness and reproduction, whether people are struggling with trying to conceive or just trying to think about what their options are for the future. There's so much that relates to trying to be as fertile and as whole as possible in terms of wellness.
So it's about your fertility now and your health and wellness now, but also we're hoping wellness for a lifetime and for your loved ones' lifetimes. Anne, how did you get into this work?
I was a patient first, which a lot of people that work in infertility actually get drawn to it because of personal experience. Originally, my goal in life was I was going to be a midwife. I wanted to be a baby catcher. I've always found birth just fascinating. And so once I graduated with my first degree in human biology, I was like, I'll move to Seattle and I'll go to UW for nursing school, and then I'll become a midwife. And so my life was like on that little plan where I finished nursing school, was able to get a job working in labor and delivery, and I loved it, and I was working nights, and you have these great, amazing births, and I would come home and I just felt like I am right with the world, like I am right on track where I need to be, until I started to try and get pregnant. And then we found out that we had infertility, and I kind of went straight down this IVF pathway, and I was still fine in my life because I just assumed, okay, well, we figured out what the problem is, and now we have to do IVF, and that's a bit of a bummer. And I still try and always put myself back in that place, because having now worked in this field for almost 15 years, everything we do is so routine to me. I don't even like think about it, but I still remember what that felt like at home, Googling on my computer when we were told we had to do IVF and being like, I have to do what? I have to do shots, and how do you get the eggs out? And I still remember how overwhelming that all felt. But I was like, well, that's what we have to do. Okay, we'll do that. But I just assumed it would work for me right away. And so when it didn't, and I had to do multiple cycles, that's when it got really hard to still be working in a hospital with other people having babies every day. It just got like emotionally draining. And there's a whole segment of our listeners, I'm sure, that are in that same situation. People that work in, pediatricians' offices or schools, or, there's so many reminders of infertility all around us. And that's what's so hard about it, is that it's this deeply personal thing, but you're still being picked at all throughout your day about it. And I remember having a follow-up consult with Dr. Klein, one of the founding docs in our practice. And she asked me, like, how's work going? I just started crying. And it was like I needed the permission from someone else to maybe think that maybe I had to change my life path, that maybe this wasn't really what I needed to be doing right now. Then I ended up working at SRM, and it was great because suddenly I realized how common infertility was. And I met all these amazing patients who were also confident, good, normal women. That it's not like there was something necessarily wrong with me that I was having to go through infertility treatment. And I took this break and then had another cycle and had success. And so I feel like that's how they looped me in for life to stay this room. Because once you credit them with your child, you're like, oh, I'm indebted to you forever. But then when I went back to school, I actually went back for a nurse midwife program program because I'm like, okay, I've done it. I've had my family. Now I'm ready to go back to the hospital. And then I was in my final clinical rotations and I was like, this is not what I want to do anymore. This is what I wanted to do 10 years
weird
ago.
How life pivots.
Yeah. But having worked with the infertility patients for so long, now it was weird to be around 20-year-olds at a midwife practice having their third baby, not wanting to drink the glucose drink. It was just like, I missed my infertility patients.
Yeah.
I want to do more just general women's health. And so then I just had to take a few extra classes and focus a little bit more on men's health, which I also wanted to do. Yeah. This is it. I'm in fertility care and I love it because I love how important it is for patients, but I also love how fast paced it is. That's what was crazy to me to go back in the hospital is I really thought after a decade away, well, surely now we'd be doing the evidence-based birth practices of not like holding our breath and counting to 10 and pushing, but nope, we're still doing it the same way. Yeah. It's just really slow to change things in OB, and IVF is not that way. Everybody wants to be on the cutting edge. Yeah. So I am super excited to be here and talk about all the things that I have seen both personally and professionally. And I can't think of a better person to talk about it than you.
Yay, thanks. Yeah, this is super exciting. I mean, I feel like there's a lot of knowledge out there and I feel like that people want podcasts are kind of one of those things that you can take on the go. And it's in a way kind of like an intimate conversation, you know, like you are kind of in your own head for a minute, which is nice. I know when you're going through the fertility treatment, you're in your head a lot, but it's sometimes nice to hear somebody else's voice in your head.
When you know I'm a runner, so podcasts are my running background.
Yes.
Well, how did you end up in this field? I mean, I know we met when you were still in your educational program, but I thought we were just like a side hustle for you. I had no idea you were going to actually decide to be here when you were done.
Yeah. So very interesting. So it all started way back in Montana is where I'm from. So I grew up in Billings, Montana. I always knew I wanted to be in healthcare. I had a very big interest in like OB in pregnancy and things during high school. So I knew I wanted to do something like that. And I got into nursing. And again, like the whole way through, I'm like, I know I want to be in women's health in some way. I knew I wanted to do something outside of a hospital. I liked the clinic setting. One of my rotations, I worked in an OBGYN clinic and I actually really liked it. And I met a couple nurse practitioners who were freaking awesome. And I was like, that's it. That's what I want to do. Because I like women's health, I am also I'm a book nerd and I just love to read things and I love reading research and medical journals. I know it's some people's bedtime material, but I was reading on IVF and things like that as I was going through nursing school, and anything women's health I would read. And I just found the fertility stuff so cool. So I was like, okay, yeah, I know I want to be a women's health nurse practitioner. And in Montana, at the time, they didn't have women's health nurse practitioner programs. I think Montana State, which is where I went, go Bobcats, I think they may have had a family nurse practitioner program at the time, but it was very new. So I was looking at different areas. Denver was another one, but I loved Seattle. I'd been to Seattle before. So I was like, yes, I'm applying to UW and I am going to go for the women's health program. RIP.
Yeah, exactly.
So I had this whole plan who I was going to apply for the women's health program. And as soon as I got my application ready, I had applied to jobs. I had a job and everything. I knew that I was moving to Seattle. And right before I moved to Seattle, they're like, oh yeah, we're no longer doing a women's health nurse practitioner program. So you can choose from midwifery, or family practice, pediatrics, or adult gerontology. So older adults. Adult gero, I'm like, yeah, that's great, but I have a narrow focus. Yeah. I like the reproductive age. Yeah. And so I was like, well, midwifery, but then opposite to you, I absolutely knew I did not want to catch babies. I was like, absolutely not. First of all, the hours seemed terrible.
Yeah, that was part of it, being back and, middle of the night and weekend call. I was like, no. I'm too old for this now. I want my clinic job. I basically want to be an old-fashioned baby catcher. I always said I did enough midwifery so that if the zombie apocalypse happens, I feel like I could help help people just give birth in the, the secret tunnels, but I don't want to work in modern hospital birth. So
no way. Yeah. It's just like the hours and all those things. Like it just didn't interest me as much as I worked at Swedish Medical Center in Seattle on the antepartum floor. So that's high risk pregnancy, and was, very close to the labor and delivery. So like I love the labor and delivery side of things. It's very cool and it's fascinating every time I see it, but I just knew that wasn't for me. And so without a women's health nurse practitioner program, I was like, well, I guess I'm going to go with family nurse practitioner because it's the broadest. I can incorporate the, the women's health side of things, as well as, treat teenagers, and then men's health too. So I was like, this is very reproductive. And that's when it got into my head, like, hey, this is actually probably the best route to go because I am fascinated in fertility. And it really just seems like serendipity because I was working nights at Swedish and newly married. And when I took my wedding time off for my wedding and my honeymoon, I came back and my body was like, yeah, no, you're not working nights anymore. So I had a really hard time getting back to nights after I'd been gone for 2 weeks and on like normal people's schedule. It's like, I know I'm kind of interested in this fertility thing. Working on antepartum, also a very emotional place because there's people that are really struggling to stay pregnant. And I found that I really, really liked that aspect of care. I liked that social emotional psych kind of component to it. So I just serendipitously looked on the SRM website and they're like, hey, we need a weekend RN to work in our OR and be the weekend nurse. And I applied, and I still remember in my interview, they asked me, so what do you want to do when you get done with your nurse practitioner program? And I said, you know what? I think I want to do this. And it's true. So when I was going through my program, I did my capstone program on my capstone project. So that's the research project that we do in nurse practitioner school as like to get our doctoral degree. And I chose to do LGBTQI plus fertility because it was also an interest of mine. So I did it on LGBTQI access to care for fertility, which was fascinating. And I did it at SRM. And
mine was at SRM too. My project was on obesity management in fertility clinics. So
yeah. It's a great place to do a capstone project. It was really fun. So then when I graduated, there was an opening. Tacoma was growing and it's still growing. And Tacoma needed a nurse practitioner. So I signed on, and I got my master's first, and I worked part-time as a nurse practitioner here, and then worked on my doctorate for the last year. And then I stayed on, and I just fell in love with taking care of patients because it's such a vulnerable and important time in people's lives. I want to make sure that as much as I can, this is a crappy time. This is a really hard thing to go through, but I'm going to try to take some of that stress from you. And I'm going to try to help you, guide you along through this process because it is so hard and you need as many people on your team as possible. And I just loved it. And I loved all my coworkers. I honestly don't think there is possibly a better place to work.
I also love the long-term relationships because working in labor and delivery, you're there for like one amazing intense day and then they're gone. And so to get to have seeing people through that whole fertility journey, and especially you and I have both worked here so long, we see people coming back for second, third, sometimes fourth child. It's pretty crazy. And so you get to really see people's families grow. And it's amazing to see psychologically the person they are at the end versus the person they are at the beginning when you first meet them.
It is something else to see people's tentative, hopeful eyes when they come in, and then depending on how things go, you can see it. And the longer you do this, you really can tell how somebody's doing pretty easily throughout their process.
Well, we had one person come back with her baby, and the way that she said it was so interesting. She's like, "It's so nice to meet you guys. Like, you've never met me. You've never met the real me. Like the person that I was when I first came here, this like stressed out, crazy mess. Like, she's like, now here I am, and I feel like, oh, that's right. This is the person that I was for all that time before I was in the thick of infertility." And I was like, that is so true. We are, and even for me as being a patient here, I mean, that initial me is definitely not the me that I am inside. And so the more that we can understand and help people through this, I mean, I think that's why both you and I love what we do so much.
Walking into a fertility clinic is very hard. It's a very hard step to take. So we'll be discussing that a little bit more in a couple episodes. We're going to talk about when it's time to make that appointment and all the things you can do mentally, physically, emotionally to get ready before starting your fertility journey, if that's where you are.
Exactly. And this is about your health, first and foremost. Both how to optimize your chances of getting pregnant to have a healthy, happy pregnancy, however that may happen, but also health because we want it to be important for your overall quality of life.
We'll be producing 2 full episodes every month, along with 4 bite-sized episodes with more information to help you get started on the right track. We're super excited to share the science and the art and heart of creating a family, whatever that family looks like.
So find us wherever you get your podcasts starting January 13th, 2022, and have a delicious week.